So it's 6 a.m. heading to work in a little bit. Today is a big day for me. I have 4 cases in 2 rooms. Usually when a surgeon is double roomed, it means that you have cases going on in one room, and while that patient is closing or while you're finishing up one case, they bring in the other patient to the next room. So the surgeon is still always in the room for the critical parts of the case, but it does mean that you have very little break time. So it's important to be fresh, obviously important to stay hydrated, stay nourished as well. So here is my meal plan for days like this. Always start off with some fruits. I use this early on in the day when I'm not super hungry. Have some prosciutto and watermelon. The prosciutto with melons we had when we were in Italy a few years ago when we were there. I found it really filling. It really kept me filled and hydrated when we were doing long sightseeing days, and I eat this during my surgery days sometimes as well. For protein, I have mozzarella sticks, these omega-3 nut mix, as well as plantain strips and the Kind Bar. They're just quick bursts of energy through the day. Of course, a bottle of hot water for hydration, really important, especially. Okay, so now I'm getting late for work, but we did get a new water, new Band-Aid for my fingers, which I cut. So grapefruit for hydration, cheese. My vice is always Coke Zero, so try to have that sometime later on in the day when I kind of need a little bit of energy. So after surgery, I have a brief clinic, see some of my patients who need to be seen quickly for more urgent consults, and I head home. So these kind of long days, hydration, protein, and kind of healthy diet are really kind of critical for me that I've learned over the years.